We all know that stress can make any medical condition worse, and fibromyalgia is absolutely no exception to this. The overlap between fibromyalgia diagnoses and traumatic events in life is unmistakably huge, and if it seems like every fibro you know had a traumatic childhood, you're not wrong. This 2012 study showed that fibromyalgia patients were significantly more likely to have experienced verbal, physical, or sexual abuse in childhood than the population at large. And let's not get too metaphysical, but totally worth mentioning is that intergenerational trauma is not just a buzzword. It's real and supported by evidence. So if you have fibromyalgia but weren't the direct sufferer of abuse, the pain you have now could be echoes from what your mother or grandmother had to endure. This is stage 3 of our fibromyalgia protocol. If you haven't yet gone through stages 0, 1, and 2, I highly recommend you at least consider them before engaging in the practices I'll describe for this stage. It's safe to start with stage 3 if it seems most appropriate for you, but if you haven't yet done the work to resolve chronic infections and put your microbiome into a healthier place, you may find that stages 3 and then 4 need to be repeated over and over again instead of having lasting effects toward putting you into remission.
Again and again.
Stage 3 is about resolving trauma, healing many parts of our autonomic nervous system, and finding freedom from the electrical and burning pains of fibromyalgia. Many of these issues revolve around the body's production of stress hormones like cortisol and the functions they govern. Since cortisol is going to be the main hormone we'll be working with at this stage, we need to cover a brief overview of its physiology. Cortisol is a natural steroid you produce with your adrenal glands. It has a normal daily rhythm to its production, associated with ancestral human activities that require its presence, such as mental or physical work, or lack thereof, such as sleep and rest, to function optimally. Dysregulation of normal cortisol rhythms is associated with all kinds of ill health, and every chronic illness from autoimmunity to chronic fatigue has been at some point associated with it. The miracles of modern medicine in the 20th century were antibiotics and steroids. The reaction to the harm caused by these medicines being overused is what fueled the talk in the natural medicine world of candida and adrenal fatigue being the causes of all chronic disease. As I've discussed in prior videos, candida overgrowth can be a problem, but it isn't specific enough to label every chronic illness sufferer with a diagnosis. The same goes here for adrenal fatigue. To make another comparison, most of what the natural medicine world says about therapies like probiotics or fascist dietary restrictions for candida overgrowth don't really make you better and might make you worse. And the same thing can be said for adrenal tonics like high doses of ginseng, glandular extracts, etc. Many people watching this video will be familiar with the injectable steroid cortisone. Cortisone won the Nobel Prize in 1950 because of its miracle effects treating patients with rheumatoid arthritis. It quickly grew in popularity and was being used for everything from autoimmune diseases to allergies. But only a few years later, strict limitations were put on its use because of the severe side effects caused from repeated exposure to high doses of steroids. Well, it turns out that when exposed to too much stress at the wrong point in life, or prolonged stress at any point in life, our bodies are generally strong enough to make themselves sick by secreting too many steroid hormones. I'm going to list out some symptoms here, and I want you to tell me whether or not you think this is steroid poisoning or a fibromyalgia patient. Anxiety, depression, burning skin, heart rhythm problems, blood pressure problems, dysregulated appetite, increased risk of infections, muscle weakness, fatigue, nausea, insomnia or sleeping too much, menstrual problems, swollen feet and ankles, worsening of digestive problems like ulcers, diabetes, or IBS. Here's the deal, it could be either one. So very often, as a result of childhood trauma or prolonged adult stress, the hypothalamic pituitary adrenal axis gets severely dysregulated and your body goes into permanent cortisol overdrive, survival mode. Survival! You are running away from the danger or the memory or epigenetic memory of danger, and while you might technically still be alive, it's making you very sick. This is also why I have to counsel every single patient with fibromyalgia or chronic fatigue not to overdo it when they start to have good days again. Yes, the temptation is going to be to make up for all the lost time and have fun and be a super mom, and on top of working 2 full-time jobs, also throw your kids the best birthday party ever. But burning out is the best way to go back into pain and fatigue. So once we get your cortisol rhythms dialed in and you're able to rest harder. You don't need to make up for lost stimulation. You need to make up for lost quality sleep and downtime. Dysautonomia, the fancy medical term for dysregulation of your body's autonomic nervous system, can be a very intricate and nuanced issue. And in the interest of trying to help as many people as possible, we're going to take a common denominator approach in this protocol. Yes, this explanation is going to be oversimplified, but I also want to keep this video under 48 hours because I know you're already sleep deprived, so I'll break it down like this. You have two modes to your autonomic nervous system. They are constantly competing for dominance, and they, interestingly enough, align very closely with this symbol that you've probably seen somewhere before. This is the sympathetic or yang side. It is the active, focused, stimulated mode where you are concentrating, exerting yourself, going full on, pedal to the metal, and it's often called fight or flight. While this mode is dominant, your body's blood and gases are in your sensory organs and extremities. Imagine you're being chased by a bear. You're not going to stop and stare off into space and compose poetry while soothing yourself with humming and gentle touch. This is the parasympathetic or yin side. It is the rest and digest side. A better time, if you will, to partake in restful yin activities. You don't have to be in this mode to sleep, but you'll almost certainly sleep more deeply if you are. Cortisol production happens most in sympathetic dominance. So naturally, when I say relax harder, many people go into a place of just believing that they should force themselves while still stuck in a constantly traumatizing environment to not be stressed out. And this belief is absolutely reinforced by a culture that promotes constant overwork and social isolation rather than shared, relaxed community building for the good of the many. But there is some truth to one aspect of that, which is that you can't just turn sympathetic off and parasympathetic on. In the way that we all feel amazing and relaxed after a good cry, we have to spin the wheel to push all the way through sympathetic dominance to get into the parasympathetic paradise where we want to be. Once you're there, you need to do what you need to do to stay. Traditional medicine attributes the burning and electrical pain of fibromyalgia stage 3 with the dysregulated autonomic nervous system, and this is almost always accompanied by a disrupted gut-brain axis and psycho-emotional disturbance. So here's what we do about it. Like with every other section, please know that this is for educational purposes only and is not intended to be medical advice or to replace the advice you've already been given by a medical professional. Please consult your medical provider before starting any new exercise, diet, or supplement. Usually in these videos, I'm covering nutrition and exercise before botanicals. Nutrition recommendations for stage 3 are simple. Avoid excessive use of caffeine or other stimulants, especially after the morning, and reduce or eliminate your consumption of alcohol. Otherwise, the diet you've been following for stages 1 and 2 should be great to continue. I'm also going to touch here on sleep hygiene. There are many resources freely available on the internet that go deeper into it than I will here, but I feel it is necessary to emphasize this as an ongoing practice. To get the deepest, most restorative sleep, you can keep your phone out of your bedroom, don't watch screens or use bright blue-hued lights before bed, and try to stop eating at least 2 hours before bedtime. I'm going to cover botanicals next because the exercise for stage 3 is a little different than what we've done before in the other stages, and you'll see why once we get there. So our tea for stage 3 is called Chayosan. This is a formula from the Song dynasty nearly 1,000 years ago, and the name has been translated into English many different ways, most commonly some variation of rambling powder or the free and easy wanderer. Those are Taoist ideals of a calm and gentle happy mindset, of being at peace and being able to ride the waves of life as they arrive and leave without losing our grounded center and clear mind. Chayosan is composed of 7 ingredients working together in harmony to balance the yin and yang sides of the autonomic nervous system. At its heart, in the center of the wheel, are porhiococos, ginger, and atractylodes. These have been featured in previous stages and take a background role here, so I won't talk about them too much other than to say that maintaining harmony in the gut-brain axis via the microbiome is important for the vagus nerve and the autonomic nervous system as a whole, and this trio does this very well at this stage. Chayosan has also been shown pharmacologically to reduce anxiety and depression by regulating the gut microflora. Chayosan is one of the most popular formulas in Chinese medicine history for stress-induced illness, and as a result, has also been deeply studied in the modern era to see how it works. We know, for instance, that it can heal blood-brain barrier injury induced by chronic stress. We know that it can help heal the hypothalamic pituitary adrenal axis when injured by chronic stress. And we know that it has a dramatic neuroprotective and antidepressant effect. It has also been shown to be superior to SSRI medication on the Hamilton rating system for depression according to this systematic review. One of the main ingredients is peony, which is known in the West as a gorgeous flower, but in traditional Chinese medicine is one of the main herbs used to relax smooth muscle and soothe the nervous and cardiovascular systems. High-quality peony contains 2 pharmacological compounds of interest here: albiflorin, which is neuroprotective, and paeonoflorin, which is magic for our heart and blood vessels. Paeonoflorin has been shown to reduce prostaglandins to decrease pain from menstrual cramps and has a longer-term effect than nonsteroidal anti-inflammatory drugs such as ibuprofen. Bupleurin was one of the main ingredients featured in the tea of stage 1, and it makes a return here to further reduce hepatic inflammation and help relieve the body of the negative effects of stress hormones, and its drying effect is balanced not only by peony, but by dongquai. We'll talk more about Dongguai in stage 4, but I want to introduce it to you here in the Chayosan family as a balm for the nervous system that can help to restore some of the depleted endocrine profile you'll likely be experiencing if you've endured chronic stress and trauma. And most importantly, it's safe to use versus some of the adrenal tonics I mentioned before, which can just pour gas on the fire of chronic inflammation. While sipping this soothing and delicious tea, the stage 3 protocol features the return of the Tibetan foot soak. This was recommended but still optional in stage 1, and most people take a break from it in stage 2. In stage 3, it is essential. 1, soaking the feet in soothing warm water and herbs is always a good way to de-stress, but the plants in the foot soak have a deeper effect I'd like to talk about. Tibetan rhodiola is under-respected as an adrenal adaptogen, but oral supplements aren't always the best way to do it. It has been shown to reduce stress-related fatigue and burnout symptoms in a randomized controlled trial, and has been used in its native environments of Russia, Tibet, and other cold climates to combat exhaustion and overwork forever. It has even been used in more Western nations such as Sweden since the 1700s, but as many have noticed from taking it, can be very challenging to dose correctly, with some people reporting worse quality of sleep or feeling even more tired all day long. This can be corrected for by using rhodiola in topical application via the foot soak. The active pharmacological compounds move through the skin and into the bloodstream where they can do their good work. Icarus also deserves mention here as a transdermal neurogenesis angel. Constriction injury from heightened cortisol levels can damage peripheral nerve. Icarus has both a calming effect on the anxiety and stress of the situation, and the unique ability to help the body heal and grow new nerve tissue. Think of it as a soothing balm for your brain. And speaking of balms, at this stage we also include a topical remedy to soothe the burning and electrical pain on the skin. Corydalis is a plant in the same botanical family as the poppy and acts via the same endogenous opioid pathways in our body for pain relief, but it has many benefits that opioid drugs do not. It is not habit-forming, does not cause gastrointestinal side effects when used topically, such as this balm, and will not make people test positive on a drug screening panel. It's safe to use as often as desired, helps stabilize mast cells, and can be a great way to get topical pain relief as needed while using the foot soak and the tea to address the deeper internal causes of fibromyalgia pain. Now on to the breathing exercise for this stage. If you've worked through stage 0, I hope you'll have been practicing the method of gratitude journaling I outlined there. If you haven't done that for a while, go give it another chance, or at least read some of your old entries and notice how your life may have changed since going through these fibromyalgia protocol stages. The next exercise I'm going to teach you can help you get your mind into a place where you're ready to make plans for your life lastingly better in every possible way. And before we move to that exercise, I need to bring up one more difficult topic. I like to have scientific evidence beyond just my own clinical experience for the things I recommend in my videos, and I'll be upfront with you all. I don't have that for what I'm about to say. I don't know if it's something that has been or could even be studied, but it's happened often enough that I have to put it in a script, and it is that after seeing dozens and then hundreds of people go through these fibromyalgia stages, there have been a lot of them that only got relief from the burning or electrical pain of stage 3 for a few days at a time until they made some very hard decisions and significant life changes. Those could be changing careers, leaving a church, leaving an abusive relationship. I've seen a lot of ways this can manifest. But if they didn't do it, the pain always came back. And if they did do it or had already done it before they went through stage 3, the pain stayed away. Pain can be a teacher. It isn't always kind or gentle or easy to understand. But when the understanding comes, the necessary action must follow. Sometimes it's work we need to do inside our own hearts. Sometimes it's actions we need to take. But when the path becomes clear, we must walk it. We call this exercise the huff and puff. Please watch this whole section once before attempting the exercise, and then you can rewind and listen to it in the background while you practice. Do not attempt this while operating a motor vehicle, while under the influence of any substances, or if you have a full stomach. You'll see why in a second. Step 1, lay down on your back on a comfortable surface. If you cannot lay comfortably on your back, you can do this in a recliner or even laying down on your side, but I don't recommend doing it face down. Pick an environment where you feel safe. That could be your bedroom, your car, again, not while you're driving, or a trusted friend's living room floor. Now take a tail end of a ballpoint pen or the eraser end of a pencil and just very gently press it into this point about halfway between your navel and your pubic bone. We're not doing this for acupressure. It's just for a little bit of feedback for the deep abdominal breath you're about to take. Now take in that deep abdominal breath, slowly and evenly. Doesn't matter if it's through the nose or the mouth. You're going to breathe in as low into your abdomen as you can, and try to use that inhalation to push the pen up towards the ceiling. This can take some practice, so if you have to work at it, that's totally okay. I have seen a lot of people who've had abdominal surgeries like a cesarean section have kind of a tough time learning this, but they do always get it with practice. Once you feel like you can move the pen up and down with your breathing, take a second, quick full inhale into the ribs and upper chest. This will come a lot more easily for most people. Then we breathe out all at once, very forcefully through the mouth. Make it a quick, complete, and intentionally forceful exhale. Now we're going to practice all three of these movements together in sequence. Into the lower abdomen, in again to the upper chest and torso, out forcefully all at once through the mouth. In, out. In, out. In, out. In, out. Repeat. In, out. In, out. In, out. In, out. Repeat. If you need to go a little more slowly than this at first, that's totally fine, but do try to work yourself towards getting a good cadence to things as you practice. You may notice yourself becoming lightheaded. That's okay. It's also why you shouldn't do this while driving. Continue. In, out. In, out. In, out. In, out. Repeat. And so on. I have fallen asleep and seen many other people fall asleep while doing this exercise. If it happens to you, you're already lying down, you'll be okay. When you wake up, you can decide if you want to continue or take a break and practice again tomorrow. If you don't fall asleep, you're going to continue this breathing method for 15 minutes. Yes, 15 whole minutes. It will seem like an eternity at first, and then as you practice it daily, you'll notice the time starts to go by a lot faster. A few other things can occur, and I want to let you know about them ahead of time so you're not afraid if they happen and you know what to do. You may feel some tingling in your hands, feet, face, or even over your whole body. This is normal and it will pass. You may feel some nausea, especially if your stomach is full. If this happens, take a break, try the huff and puff again in a few hours or the next day. Make sure your stomach is empty. If you have delayed gastric emptying, consider the abdominal self-massage and botanicals from stage 2. And lastly, this won't happen to everyone, but you should know you may start to have some tetany, aka lobster hands. This is usually scary the first time it happens, and I want to impart to you that there is nothing about it to fear when it comes from a breathing exercise, and it will pass quickly once you return to a normal breathing pattern. Usually this will just be in the hands or feet, but it can even be in the face or abdomen. It is a result of increasing oxygen while decreasing carbon dioxide and a resulting rise in pH as the bloodstream becomes more alkaline. If this happens, stop the huff and puff and intentionally slow your breathing down. In slowly through the nose to a count of 6, then gently release through the mouth to a count of 6. Repeat as often as you need to until the tetany goes away, then try again tomorrow. Many people will experience a significant emotional release when they begin to practice this exercise. This is why I emphasize you need to be in a place where you feel as safe as you can to do it. I have seen this be in the form of crying, sobbing, screaming, laughing uncontrollably, or a mix of all of the above, and I have seen it happen multiple times as people repeat the exercise. They will often relate to me afterwards that memories of old trauma, even sometimes the trauma of their ancestors, or visions of unspoken fears will arise when this happens. Breathe it out, scream it out, cry it out, do whatever you need to do to let it go. Then do it again tomorrow. It takes a deep reserve of courage to allow our bodies to be a vehicle for this kind of release. You will most likely be very tired after the huff and puff, but many also find they are finally able to rest and be at peace in a way that they could not before. Savor this and know that you can come back to it anytime you need to. The standard recommendation for patients in my practice is to do this daily for 30 days, to journal about the experience afterwards, and to keep the exercise in your back pocket for when life inevitably interferes with our best laid future plans. I wish you the very best, and I'll see you again in stage 4.